Assalamu alaikum and welcome to another episode of Hello Doctor, the TV show where we talk about common health conditions that affect our society today. We'll be giving you all the tips and tricks on how to live a healthier and safer life. I'm your host, Dr. Saheel Mahmud. A quick introduction into myself. I graduated from King's College London with an MBBS and I also have a BSc from Imperial College London. I'm currently a junior doctor working out in Essex. We're very lucky today to have a special guest on our show, Mr. Anurag Jain. Mr. Jain is a consultant ENT surgeon, an award-winning consultant ENT surgeon who graduated from India, Delhi with an MBBS and then went on to complete two masters related to ENT. He also has a postgraduate qualification in healthcare leadership. As well as this, Mr. Jain has numerous accolades and awards, including 2 awards from the American Head and Neck Society, and is the author of numerous peer-reviewed articles. He has a keen interest in pediatrics ENT and also teaching the next generation of doctors. Welcome to the show, Mr. Jain.
Thank you very much, Saheel. Thank you to TV1 to invite me to the show. And good evening, Assalamu alaikum, and namaskar to all my viewers here.
Thank you for joining us today. So before we begin, to the viewers at home, you should be seeing a number at the bottom of your screen. That's a number for the studio. It's a live audience today. So please do call in if you have any ENT related problems. We have the expert sitting right here who's more than happy to help us with any ENT related issues. However, if you're experiencing any acute emergencies, then the best thing to do is call 111 or 999. But please do call in and add to the conversation if not. So Mr. Jain, thank you for coming. Why don't we start with what brought you into medicine in the first place? Talk about your journey into medicine.
Absolutely. I started my medical school journey in 1988. At that time, I was in Delhi in India. Ours is a family, was a family of engineers, but at that time, for most kids, the most attractive career proposition was either being a doctor or engineer.
Yes, of course.
But my elder sister, who is currently a doctor in Delhi, she actually inspired me to be a doctor. She used to discuss with me how she is able to help the patient. She was a third-year medical student at the time, and this actually inspired me to be a doctor, and that's when I knew that I'm going to be a doctor for the rest of my life.
That's great. So it runs in the family, it seems.
Yes.
So that's your medical education. When did you decide that ENT was the specialty for you?
That's another crossroads and very important one too, because as I finished my medical school and I was starting my internship, at that time you have to decide that what subspecialty you're going to do for the rest of your life. I always believe that do what you like and like what you do. For me, there were 2 main categories, either surgical specialty or non-surgical. For me, the way I am, the active surgical management in a surgical specialty always attracted me. I like to be able to see a difference I've made. For instance, a child suffering from recurrent tonsillitis, you can take out their tonsils, help them, and they are very grateful. So that's something that attracted me towards ENT. ENT is a good specialty, and the range of patients you encounter is wide, ranging from children, pediatric age group, to elderly patients.
Yeah.
And it involves ears, nose, and throat, so a wide variety of conditions you can help patients with.
Exactly.
And it also has a work-life balance. I like spending time with my family, and that's why I went into ENT.
And I know you have a keen interest in the pediatric population. You're the lead for Barking and Havering. We'll touch on that in a second. But before we do, I want to talk a little bit about your journey from India to the UK. Now, they're obviously 2 very different clinical settings. What was it like when you first came over? What were some of the challenges you faced?
Absolutely. So I finished my post-graduation and came to UK more than 22 years ago. And I then completed the training program here of ENT, and also was very lucky to get a pediatric ENT fellowship at Evelina Children's Hospital within the St. Thomas Hospital for a year. So that gave me deep insight into how to manage the complex pediatric patients. I was also lucky to be trained at UCLH Cancer Center in Central London. So I've been now a consultant ENT head and neck surgeon with a subspecialty interest in head and neck thyroid surgery, and also pediatrics ENT at Queen's Hospital for more than 6 years.
Great. So let's talk about some of those common conditions in the pediatric population for ENT. So I think one of the common ones would be nosebleeds, and that's obviously quite common in young children. It can be quite worrying for the parents if their child is having recurrent nosebleeds. Why don't we talk a little bit about why people get nosebleeds and what the management is for that?
Absolutely, and as you said, this is a very common condition, and this can be quite distressing not only for the child but for the parents as well, because they often have to call back from school, they have to it disrupts their studies, and it's quite scary as well. Now, kids, as they are, like they get infection, viruses, they get runny nose, they might have hay fever. This runny nose can dry up and make crusts like bogies in a dry, cold weather, and can irritate the nose. That triggers them to scratch their nose, and which can proliferate the blood vessel and trigger off a bleeding. Any patients or parents encountering having this problem with their children, I would first of all advise them to use a saline nasal spray, which is freely available over the counter from any chemist, with a view to lubricate their nose and moisten them so that crusts are not as irritating. They can also use Vaseline.
Okay.
But of course, if it continues to bleed, it's time to see a GP for a referral or a prescription of a antibiotic steroid cream.
So if it's a continuous bleed, then that's when they should start seeing your GP and then looking into referrals if it's continuous. But in the acute, when it's just one or two, then they can manage that at home.
Absolutely. And by the time patients are referred to me, you examine them, they would have tried the nasal cream and the saline nasal spray. And more often than not, we would find a blood vessel in the front of the nose, which you can cauterize using a chemical seal, which sorts it out in most of the time. And that is a simple procedure. It can be done in the clinic.
Good, great. Well, I'm sure the parents at home are a little bit relieved after that. Moving on to another condition that can sometimes affect the pediatric population quite a lot, but also the adult population, ear infections. Yes. How do we deal with ear infections? Why do we get ear infections?
Absolutely. Again, this is a very important question. Let's talk about the pediatric age group first. In children under 5 years of age, it's very common for this age group to have glue ear. And that can happen because the tube that connects back of the nose with the back of the eardrum, it's a bit twisted, and they get recurrent viral infections, and this can get swollen and blocked. Once it gets blocked, it can develop vacuum behind the eardrum. And if it persists, it can lead to fluid, which is like glue, and causing glue ear. If this persists, the water being stagnant can get infected and cause ear infections. In adults, it can happen just because of infection traveling from back of the nose through the tube into the middle ear and causing ear infection. So yes, this is a very common problem and can cause significant distress to the patients.
And what sort of treatments are there for ear infections for both pediatric patients and adults?
In a pediatric patient who is suffering with recurrent glue ear, obviously this is a condition which can fluctuate. It tends to be worse in winters and tends to resolve in summers. To start with, there are national guidelines as well with regards to management of glue ear. To start with, I would examine them, obviously do a hearing and a pressure test for them. And once the diagnosis is confirmed, I'll advise them to basically equalize the pressure. In adults, you can ask them to kind of pinch their nose and try and blow hard with a view to throwing some air down the tubes to unblock it. In kids, there is a balloon, auto vent balloon, again freely available from the chemist. They can try that. If it persists for 3 months or more, a surgical option might be necessary if it causes significant persistent hearing problem or repeated ear infection in the form of grommets.
Sure. And so for the viewers at home, what exactly is a grommet?
So grommet is essentially a thin tube. It sits on the eardrum, and it takes over the job of the tube, which if there is persistent glue ear, that means the tube is blocked, so it's not working as well as it should. And it requires a small procedure, but we only consider to do that if the hearing loss is persistent, and it's persistent for at least more than 3 months, and it's affecting the child's studies.
And keeping with the ear, so another common thing that can happen to both adults and pediatric patients is earwax, the buildup of earwax. We all have earwax. What's the function of earwax?
Absolutely, I'm glad you brought that up. Earwax is a common constituent in the ear. It's secreted by ceruminous gland, and it has function. It has several functions. It lubricates the ear canal. It has some antibacterial properties, so it's not completely useless.
Okay, great.
The type of earwax a person produces is genetically determined. So some people tend to produce more powdery type of wax. Some people produce more thicker or sticky type of wax.
Right.
In general, in your ear canal, which is lined by skin, there is a very thin conveyor belt which moves very slowly, and hence normally people don't have to have their ears cleaned out because this wax is continuously cleared. Ears are meant to be self-clearing. Now there are two main conditions in which the ear wax may not clean spontaneously. One is when the ear canals are very narrow, and hence the conveyor belt which throws the wax out is not working very well. The second condition is when someone has very hairy ear canal. The ear canals is full of hairs, and that blocks the wax to clear itself. Another third condition is when in adults, perhaps when they use a hearing aid, or in youngsters when they use too much of a iPods or earphones for a long period of time, when this conveyor belt fails to throw the wax out. So that's when it becomes a problem. The thing I will urge the viewers is not to use cotton buds, which is quite often the case. And if you try with a cotton bud, you won't be able to clear a wax, but you certainly will push it inside, which is often what I see when the patient comes to me.
Exactly.
It can be easily treated by a microsuction of the ear. It requires an ENT appointment, and this is the gold standard. Traditionally, syringing used to be done, which means flushing the earwax out with water, which is not recommended anymore because I've seen too many ear infections or worse, even ear perforation caused by syringing. The gold standard now is a microsuction of ear. It's like a small Hoover.
Okay.
You have a look under the microscope, under magnification, and take out the wax with a small Hoover.
I see.
There are, you can use olive oil ear drops or sodium bicarbonate, again over-the-counter ear drops, to soften the wax so that it comes out easy.
Yeah, so a fair warning to all the youngsters listening, maybe slow down on the AirPods and the headphones to prevent the earwax from building up. So keeping with earwax, and we were talking about perforation. Sometimes it can be because of microsuctioning or pushing in with a cotton bud. Does that heal by itself? What happens with the perforation of the eardrum?
Yes, in acute, let's say someone traumatized the eardrum with a cotton bud, which is not recommended, as I mentioned. As long as the ear doesn't get infected, it tends to heal very quickly. Okay. Which is the most cases. Let's say if someone has long-term or chronic ear infection, where there is continuous infection in which the perforation gets mature, it doesn't heal itself, unfortunately. If there is a long-standing perforation, which technically is called as chronic suppurative otitis media, if it's not causing any problem, we always advise the patient to keep their ears dry while taking a shower or bath, by putting a cotton wool, smearing it with Vaseline to make it waterproof. If it doesn't cause any problem, you can just observe it and not do anything. If it causes problem in terms of regular ear infections, then an operation can be done to patch the eardrum.
Okay. So in the conservative sense, we don't do anything. And then if it's causing a recurrent problem, then we can patch the ear.
Absolutely.
Okay, that's great to hear. Well, let's move on to another part of the body, the thyroid gland. Now, we know what the thyroid gland is, but for the viewers at home, what exactly is the thyroid gland? Where is it? What does it do?
Thank you for asking this, Saheel. Thyroid gland is a butterfly-shaped gland. It's present in front of our neck. It's present in everyone, and it secretes thyroid hormones, which is essential for growth and development of the body, for metabolism of the body. So there are two issues usually associated with thyroid gland. One is the thyroid function. It produces thyroid hormone, as I said, and a person might have overactive thyroid or underactive thyroid. Overactive thyroid will manifest with symptoms such as heartbeat, which is like palpitations, or feeling very hot, or losing weight, in spite of having increased appetite and things like that, feeling hot, heat intolerance. If it goes on the other way, underactive thyroid, person might encounter increase in the weight, hoarseness of voice, or constipation, and feeling dull and lethargic, losing hairs, things like that. Um, this can be detected by a single blood test if a patient is having a symptom, which your GP can do.
Okay, great.
And based on whether it's underactive or overactive, they can treat it by either thyroid hormones or with other medicines to suppress the thyroid function. Of course, if it is normal, then that's a reassurance for the patient that it's not thyroid.
Of course. And so if it's underactive, the medication given just boosts the level of the thyroid hormone. Now, if it's overactive, there are some medications to help with that. Are there any surgical techniques that we can use with overactive thyroid?
Absolutely, yes. So I'm one of the designated thyroid surgeon at BHR, and quite often I get referrals from my colleagues in endocrinology who are the specialists, by the way, in medical aspect of thyroid, that is over or underactive thyroid. So sometimes they try with medicines first, like carbimazole or other medicines. Some people can't tolerate it. Some people have side effects with it. Some people don't want to be taking this for the rest of their life. So then the patient is often referred for hyperthyroidism to us to remove the whole thyroid gland. They will still require a thyroid supplement for life, but that will remove the overactivity of the thyroid once you remove it. So that is one of the indication to remove the thyroid gland, overactive thyroid.
So if any of our viewers are experiencing the symptoms that you've described, so losing weight, feeling hot, fast heart rate, then they should probably go to see their GP for a thyroid blood test, you're saying?
Absolutely.
Okay,
yes.
Great. Now, I want to just shift the questions back to you for a second. We were talking just before the show about your achievements in academia, but also your achievements in medical education. That's something you're quite passionate about. Why don't you tell us a little bit about what you do to help the future generation of doctors?
Yeah, sure. Thank you. I have a keen interest in medical education because I believe the future of our specialty, or any specialty for that matter, is in the youngsters like yourself, our budding ENT surgeons, our budding GPs. And I therefore take a keen interest in medical education. I'm one of the examiners of a diploma in otolaryngology, head and neck surgery in UK. And I'm also one of the examiners in European board examination in ENT. In addition, I'm also invited faculty in several of the ENT courses in UK. I get a lot of medical students in Queen's Hospital, and I always say to them that obviously my job is to give them a taster of what ENT is like, what things I can tell them about what attracted me to ENT. ENT is a very good specialty with good work-life balance, where it encompasses a wide variety of situations, like let's say neck lumps, big thyroid lumps, which require special surgical skills which are more gross, to ear perforation, which require microsurgery to patch the eardrums under the microscope. So it requires finesse. The degree or the challenges associated with every surgery is slightly different, and that excites me. It's got so that's what I say to medical students. Just hopefully within the time they experience themselves what they're getting in, and based on what they're like and their interests, they can make up their mind.
So ENT surgeons have a little bit of everything, the small microsurgeries to the bigger thyroid surgeries, and I guess that's an appeal for a lot of budding medics and surgeons, getting to practice that smaller surgery and also getting to practice the sort of larger surgery as well, which is great.
Absolutely.
What would be your advice for anyone that's looking to get into medicine in the first place? So anyone perhaps 16, 17, applying to university, wanting to study medicine, what's your best advice that you would give them?
Absolutely, and I suppose it will be useful to spend a bit of time with your work experience in a doctor's surgery or in tertiary setting in the hospital to see what it's like, what they're getting into, and hopefully once they're exposed to what it's like, they will be able to make up their mind. It's a very rewarding profession, I must say, for myself. And it's really rewarding when you see, the patients getting better and they come back after surgery, and if they're better, they're grateful. So that's the main reward for me.
Exactly. Well, it's nice to hear that you're really invested in the patient as a whole and their care, which is great. Going back to some of the common ENT problems, we hear this term quite a lot, vertigo, especially when you go to the GP might diagnose you with vertigo. What exactly is vertigo?
So vertigo is a technical term used for dizziness. True vertigo means that the room spins round, but quite often the patients I see, they've been referred as vertigo, but when you ask them closely, it's a bit of lightheadedness. There is a wide range of conditions or factors which can cause vertigo or dizziness or lightheadedness, which includes cardiorespiratory factor, irregular heartbeats, high blood pressure, low blood pressure, or it could be...
So we just have a caller on the line. We'll come back to vertigo in a second. Caller, if you could introduce yourself and tell us where you're calling from and what your question is. If the caller could just introduce yourself and tell us where you're from, and then we can get straight to the question.
Hello, if you can hear me, my name's Saheel. Saheel, how are you?
Walaikum salam, Tafsir, how are you doing?
I'm good, thank you. I think the line was just a bit dodgy a second ago.
That's okay.
But thank you for the show, and to the Dr. or Mr. Jain that's come in today. Hello.
Hello. Hi, Satri.
Hi. So I just had a question regarding the best way to get involved with ENT as a medical student or as a junior doctor. I'm a colleague of Saheel. We work together in the hospital, and there's a few of us quite interested in ENT. Wondered if we could get involved maybe from a medical point of view, from a student point of view, and as a doctor as well.
Absolutely, that's a good question, and I often get asked that. So if you are obviously depends on what level you're working, and if you're working as a junior doctor in your hospital, and if you are interested in a specialty, I would strongly advise you to perhaps take an appointment with, obviously discuss that with your tutor, and express your interest in ENT, and perhaps contact, I'm sure your tutor can help you get in touch you with a local ENT consultant, who I'm sure would be happy to have you in their clinic, their theaters, and see what it's like and discuss. And also, you might be able to get involved in some research or audit projects, which will give you an idea of what it's like, and also will be good for your CV. So that would be my advice to you.
Hopefully that should give Tafsir some ideas on how to bulk up his CV and go into ENT.
Absolutely, and one more thing I might add, I would advise you to check the ENT UK website. There is a branch of ENT UK, I think SFO it's called, Foundation, and they help students like yourself and junior doctors who are quite interested in ENT, and there is a venue, and there are a lot of opportunities to present or publish as well. So
perfect. And that brings us nicely to our break for today. So we'll catch you after the break, where me and Mr. Jain will be continuing to discuss common ENT issues. As I said, if you have any questions at all, please do call into the studio. We're here. We are ready to open up the conversations to any ENT problems that the viewers are having, and we'll see you after the break.